registered nurse at Karratha Health Campus in the emergency department, and I love it. So I got my grad program at Karratha Health Campus, and they did a split rotation, 6 months on the ward and 6 months in emergency. And then after 6 months in emergency, I just fell in love and I ended up getting permanency and staying here for 1.5 years now. I can't imagine leaving just yet.
The hospital community itself, it's just, you're so supported here by your general colleagues, because we're a team, because we have such different backgrounds as nurses, that what I don't know, that other nurse will know, and vice versa, regardless of how many years you've been a nurse. We just really work as that team. As rural as it is, you get a lot more opportunities. You don't only do your triage, and you don't only do your do observations or assessments. You get to work with the doctors, and you get to do the treatment, and you get to do the management, and you get to do the follow-up. You get to do it all instead of the one skill you focus on.
You can advance your skills here. You can do nurse x-ray operating, plastering, you can work rapidly towards your cannulation and things like that. You see a lot remote and rural and get exposed to quite a vast array of presentations. You get to work with Indigenous populations. I think that's probably one of my favourite things is working with them, and really they give us an understanding culturally.
We now have newly qualified nurses undertaking an emergency nursing transition program in their first year of practice. We're always teaching, whether you're a new grad or a very experienced nurse that's after that change. Everyone needs to be supported and educated throughout their career.
Once you actually get in here and you actually see the work and you see the hospital and see the people and you participate in it, yeah, you're going to fall in love with it. You just got to give it a go. That's it.
Because our ED is really well staffed, our wait times are the best in the country, so we don't have those issues with ramping and bed block that you get in other places. So it makes it a really enjoyable place to work. We've got a young nursing staff, we've got a really good team, we're all really good friends, so it's a really positive department to work in.
I came here because I had the opportunity to lead a team. I was offered a CNM position, so I just couldn't say no. And it was a big step up for me, but I had amazing support from all the managers here, the clinical, the John, even the executives, everyone, and even my own current team. They accepted me well, and made my transition a bit more easier.
The ALO that I believe its role is to advocate for Aboriginal patients, to be the interpreter, because most of my people, they can speak English but they cannot understand English. Be the communicator in the middle for them, also to get at the support that the Aboriginal community needs as well, to provide and to explain the services that WA Country Health Services provide.
If I was talking to a nurse who wanted to work for WACS, I would say don't hesitate, absolutely do it. I wish I'd done it sooner in my career. So if you want to further your career or go in if you don't want to stay clinical and you want to go management or you want to be staff development, I really think that the opportunities are abundant, and you just need to put your hand up and say that's what you want to do, and it seems to work.
We've got a really lovely unit here, and it's nice to be able to use your maternity skills, be more midwifery led in your care, but also know the doctors are there for us.
I think there's a lot of opportunity for professional development. Sometimes the work can be really challenging, so you're experiencing different things in work roles that you wouldn't in a metro area, which can be challenging but can also be really good for learning if you're open to that.
You get to learn things and you get to see good cases down here as well, from a normal GP presentation cases to a multi-trauma. So we get all sort of presentations, and we get to expose ourselves to an Indigenous population as well.
You become part of the community. It's the team, it's the people, but also, we're making work life better and patient care better, and really striving to improve that all the time. So that's what makes me get up and come to work.
So I've come home. I was born and bred here, and come home to work and live. So mainly for family reasons, but obviously because I love rural work. I think that continuity of care and being able to follow someone, especially in obstetrics, following someone from the first moment that they find out that they're pregnant right through to their birth and then afterwards. So I think that makes a difference.
Helping and the passion of mental health illnesses, and educating Aboriginal family, what it means at first point of contact. I like to give them educated as much as I can.
There's lots of things that are rewarding, but for me personally, I think the relationships that I've built with the residents here, finding out about their families and their culture and their history, they're very happy to share that with us.
Since working here, I have made some really good friends, some really close friends, and we work together, but then we also socialise together as well. So there's always something to do. You wouldn't move here if you didn't want to do anything because it's really busy.
Definitely the opportunity to step up into managerial roles. I don't think I would have that opportunity in the city, to be fair. So it's a beautiful opportunity actually, and something that I'm very lucky to do, and I didn't think I'd be able to do it this early in my career.
I work in more a regional role and in a regional team, so we go everywhere, which is probably the highlight of my career. We get to go to remote Aboriginal communities thousands of kilometres away in the Western Desert, as well as travelling, even just to Roebourne, which is around 40 kilometres from Karratha.
I think why I like WACS, and for the health department, I've only ever worked for WACS. Just the variety of work, I think, especially rurally. You're not doing the same thing every day, so I like variety in my work.
If you want a part of a fantastic family, nursing family, this is a place for you. If you want to upgrade your skills, this is a place to come to, because you're going to get lots of experience.
You will find nothing but a loving community of healthcare professionals, to treat you well and guide you in your transition to rural and remote practice. But you will also be welcomed with open arms to these beautiful small communities that love and respect you as a healthcare professional.
But oh my God, it's going to be the most rewarding experience I think I have ever had in my career. And to think you can make a difference to the community here and bring your skills, it's my pleasure.
Nursing and midwifery can really take you anywhere. So it's really about you as an individual. So grasp every opportunity that comes your way. Never say never, because you really do not know where your career is going to take you.
I'm living the dream. I love it. I love Newman. I love my job.